My name is Alicia Johnson, and I'm Public Information Officer for the Missoula City County Health Department's COVID-19 response. Today, we are going to provide an opportunity for our epidemiology team at the University of Montana, give them a chance to present some data on COVID-19, as well as allow our City Council President, our Health Officer, our Incident Commander, and the Health Department's Medical Advisor a chance to talk about what this means for Missoula. The way that things will work today is we'll allow each presenter a chance to speak, and then at the end, we will allow the press a chance for questions and answers. Please, just if you can, be patient as possible with me. This is the first time I've used this platform for a press conference, and we will do our best to accommodate all of the questions that you guys have in the time that we have today. Our anticipated lineup, Dr. Ethan Walker from the University of Montana School of Public and Community Health Sciences, Dr. Aaron Simmons from the University of Montana School of Public and Community Health Sciences, Health Officer Ellen Leahy, Dr. David Christensen, who's the Medical Advisor for the Missoula City County Health Department. We also have City Council President Brian von Lossberg with us today, as well as Incident Commander Cindy Farr. And with that, I will turn it over to Dr. Walker.
All right, thanks Alicia, and thank you everyone for joining the call today. Myself and Assistant Professor Aaron Simmons will be presenting information on COVID cases today in Missoula County. Aaron and I are part of the School of Public and Community Health Sciences at We're also part of the Epidemiology Situation Unit for the county, which is a collaboration between and the Missoula City County Health Department. I'll start off today by saying that as of now, there are 41 confirmed cases of COVID in Missoula County. This first figure is presenting the frequency that various symptoms have been reported among those 41 cases. You can see that cough and shortness of breath is the most commonly reported set of symptoms. Now, fevers, chills, achiness such as body aches and headaches, as well as sinus and throat symptoms are also commonly reported in the county. Also note that these symptoms are fairly evenly spread across male and female cases. Now, this next figure is reporting cases that occurred through community spread. Community spread is when someone contracted COVID, but they had no known travel outside of the county and no known contact with a previous COVID case. So essentially they contracted the virus from an unknown source within a community. Now, so far, 8 of the 41 cases in Missoula County have occurred through community spread. This is an important reason to be careful in your social interaction. You can contract the virus even if you don't travel outside the county or interact with a known case. The next figure is displaying the number of individuals that each case of COVID has come into contact with and potentially exposed to the virus. Over half of the cases contacted 5 or fewer people, and this is actually great news. It's important because the public health personnel have to do contact tracing, where they follow up with individuals who may have been exposed and assess their potential for becoming infected. And when there are fewer cases, contacts by each case, it puts less of a burden on public health officials to conduct contact tracing, and it decreases the potential for the virus to spread. And this is another reason why it's important to practice social distancing. If the number of cases, contacts by each known case goes up, it will become more and more difficult to trace the potential cases and slow the spread of the outbreak. The next figure you see displays the incidence of COVID across age groups. Incidence is the number of new cases of the virus divided by the number of individuals in the group from which the cases came. For example, for the 20 to 29-year-olds, we took the number of cases in that age group and divided by the total population in that age group. In these results, we took it a step further and reported incidence per 100,000 population within each age group. Now, this ensures that the population with each age group is the same and allows us to more accurately compare case numbers across age groups that would otherwise have different populations. In this figure, you can see that younger individuals, and particularly those in their 30s and 20s, they have a much higher incidence than the older adults in Missoula County. This figure highlights the need for younger adults to practice careful social distancing, particularly as the phased reopening begins and we encounter more social interaction throughout the county. If we continue to practice responsible social distancing, it might help slow the spread of the virus and keep the outbreak under control. The last figure that I'll talk about with you today is what we call an epi curve. Now, this displays the number of cases across time during the outbreak. A couple of important points to note about this figure is that, first of all, there's a lag period of several days and possibly up to 2 weeks between the time a person feels symptoms, decides to get tested, and then test results are returned confirming that they are a case. An estimate of this lag period is indicated by the shaded region in the graph, and as time progresses, we may start to see more confirmed cases in this shaded area. Also note that until very recently, testing has been limited, so there have been almost certainly more than the 41 cases that have been confirmed so far. And also note lastly on this figure that there are 2 dotted lines indicating when social distancing measures went into place. The line on the left is at March 16th, around the time schools went on spring break and when bars and restaurants began closing. The line on the right is at March 28th, when the statewide stay-at-home order went into effect. Some important takeaways so far. If you look at this figure, it seems that social distancing guidelines have been effective. The majority of cases had symptom onset in mid to late March. This is prior to the time when social distancing guidelines were implemented, as indicated by the vertical dotted lines. However, we've still seen some cases occurring after the social distancing guidelines were put into place. So with this, there are some key messages that we can touch on. Although things are opening up and we are beginning a phased lifting of the restrictions, it doesn't mean that COVID is gone from the community. Remember, we've already seen community spread within Missoula, cases from unknown sources within the community. In addition, young age groups are contracting and potentially spreading COVID within the community, and testing to this point has been limited, so there are likely more cases than have been confirmed at this point. Because of all these considerations, it's important to continue following public health guidelines as restrictions are being lifted. It's up to all of us to continue to slow the spread of the virus and protect the vulnerable populations within our county. With that, I'll turn it over to Aaron Simmons, who will walk through some of the projections that our group at UM has been working on.
Thanks very much, Ethan, and thanks for the opportunity to share some of our work. So what Ethan has just shown you contains actual data from Missoula County. So this is actual data that has helped to inform policy choices in our community. But what I'm going to talk about now are projections about what might happen and how our choices can make a difference. You've perhaps heard much about COVID-19 modeling in the news. There are many models out there. No one model is perfect. Each model has different assumptions. And when it comes to modeling, it's really the more the merrier. And this is because there are many approaches to projecting COVID cases and resource needs in the context of the pandemic. Each model relies on numerous assumptions and inputs, such as testing capacity, for example. These factors can vary widely over time and place. Some models which work well in some parts of the country might not be as useful in more rural areas. Moreover, even within a particular model, results must be viewed as changing. They're dynamic. Modelers are constantly updating and refining their models as new data come in. And so before I get started in showing you some of our models, so while they're valuable, we should really not view them as forecasts. They cannot predict the future because we do not know what the future holds. Changes in human behavior, treatments, and policies all will influence what actually happens. And so for these reasons, it's really critical to consider multiple high quality models, each with their own strengths and limitations. And really, it's best to think of these models as putting guideposts around the range of possibilities we might experience. And so the model we are focusing on at the University of Montana and the Center for Population Health Research is what is called an SEIR model. And so this is where people in the community move between being susceptible, exposed, infected, and recovered. And so the rates at which people move between these boxes influence the number of cases in the community at a given point in time. And using observed case data and well-justified assumptions regarding things like hospitalization rate for cases, for example, we can then use these models to project future cases and, importantly, demands on healthcare resources. And so, Ethan, if you would move to the next slide. Thank you. And so the critical driver to this model, to an SEIR model, is the reproduction number. Maybe you've heard about this before. And so this is, by definition, the average number of cases that each case infects. And a number of factors influence the reproduction number, including the number of contacts and the disease transmission, given you have contact with a case, as well as the duration of the infectious period. And so the good thing is we can intervene on some of these factors. So, for example, social distancing will reduce the number of contacts a case has. Ethan presented the pie chart on the right already, which shows that the majority of cases in Missoula County had between 0 and 5 contacts. And so this is really good and helps to minimize the spread of COVID. But note that the number of contacts a case has can change quickly as we ease social distancing. Another factor on which we can intervene is the likelihood of COVID transmission if you are exposed to a case. So we can lower this probability by washing our hands or wearing masks, for example. So it's important to just remember that there are things we can do even in the absence of a treatment for COVID. Next slide, please. So I've talked about what models are a little bit, what influences them, and how they can be used. But I just want to spend a quick minute re-emphasizing what projections are not. As I mentioned, they are not a crystal ball showing what the future holds. We do not know what is going to happen because that depends on policies and our behaviors. And so these, that said though, these projections we are showing are based on cases and reproduction numbers observed in Montana during the COVID-19 pandemic. And this graph shows the cumulative percentage, the projected cumulative percentage of the Missoula County population infected with COVID-19 under different scenarios with respect to social distancing and probabilities of transmission given contact with a case. This model was developed by Dr. Erin Landguth in the School of Public and Community Health Sciences at the University of Montana, and we're lucky to have her joining in this meeting, as well as Dr. Curtis Noonan, who has also contributed greatly to the modeling effort. And so these graphs, Erin's updating these graphs every day. This graph was last updated yesterday, and it shows future projections for the percentage of the population that has ever been infected, both symptomatic and asymptomatic. For a given point in time, this would then include people who are currently infected, as well as people who were infected and recovered, or those who died. And so first note in the lower left-hand corner, the vertical dashed line. So the curve to the left of the dashed line displays information from the past, while the curves to the right are the projections. And so let's get to the projections. Let's first start with the bottom right. So the black line shows this is the idealistic social distancing scenario where we have a stay-at-home order for a long time. As we know, this is no longer the case, but we wanted to include it here for comparison purposes. The red line in the middle shows the increase in the percent of the Missoula County population infected, the projected percent, following transition to phase 1 opening this week, but where some social distancing and adherence to them, importantly, remain. The blue line on the top is similar to the red line. However, it assumes less community adherence to social distancing. And so you see what we really want to point out here is you see a big difference in the projected percent infected between the blue and the red lines. And so I want to note that in this example, we assume only about a 10% greater contact rate and probability of transmission among the population when comparing these two lines. And so we have to remember that of these people who are infected, some will go on to develop serious illness and need to be hospitalized. And so I'll just finish here by saying, while things are opening, we know that this does not mean that COVID-19 has disappeared, and what we do and the decisions we make will matter with outcomes. Thank you.
Okay, to Ellen.
There we go. Thank you. I want to extend my thanks to all our members of our epidemiological situation team, our medical advisor, Dr. Christensen, City Council leader. And I also want to point out that Missoula City County Health Department and the University of Montana School of Public and Community Health Sciences have formed an academic health department to do work such as this, bringing the expertise, research directly in contact with the practice in the community. So very appreciative of that. I think most of the points that I wanted to make about contact tracing and the number of contacts have been covered. So I will just emphasize that it is pretty rare in a respiratory spread disease that we would ever see less than 5 contacts per case. I mean, I've not experienced that before. We had a huge pertussis outbreak in the last spring, and again, a lot of different scenarios. It was affecting school age, high school age, so on and so forth. So you would expect more contacts, but we had hundreds of contacts, and many of each kid might have 100 of their own. So I think it is a very good reflection of the stay at home and the people's observation of stay at home to have that small number of contacts. Where it's also important is, yes, some of those may go up. That may not be simply because somebody went out and ignored all social distancing. It may be some other failure in the system. And there are people in delivering essential services that do have some protective equipment and some mitigation, but I think you're all aware that none of those are completely fail-safe. So with that in mind, I want to connect the contact tracing as we open up to the testing, which Dr. Christensen, our medical advisor, will speak about next. There's a lot of talk in the press about, are you ready to contact trace? Well, we are. That's the part of our operation we built up, like starting back in March, very early March, March 2nd, adding our nurses, or reassigning them, training additional folks. And so that's all under operations. Would we be able to keep up if a number of cases came in and they happen to have large number of contacts? I can't say yes that we would, but we are planning for that type of surge should we need it. But I think one of the most important things to think about contact tracing, as it's being talked about in the media, and the governor came out with the testing and contact tracing plan and additional funding, which is all excellent, is that you can't contact trace someone until you have a case. And you can't have a case until you have a test. And so currently, even though it's improving, the testing part of that entire response is the weakest link. So I will end with that and turn it back over to Alicia to move us forward.
Thank you, Ellen. Dr. Christensen.
Thank you. Just a little bit about testing. We've been hearing a lot about testing. Currently, our best test for the novel coronavirus is a PCR-based test, and what that test involves is collecting a specimen from the respiratory tract, sometimes from the nose or the mouth, where the virus is dividing and infecting, and detecting the DNA from that virus. So this is a very good test, but we're learning as experience increases and this outbreak evolves that it's not a perfect test. It's most sensitive, meaning that it picks up most of the cases when the test is done early in the illness, but even after 4 or 5 days of symptoms, there is maybe as high of a 1 in 3 chance that a properly collected specimen will be negative. So we call that a false negative test. If we test somebody that has disease, the test sometimes doesn't pick it up. So that is our current best test, and our testing capacity is definitely increasing. Right now, the number of available tests is not the limiting factor. At least in Missoula County, we have the tests that we need, and we're hoping that capacity increases, as it definitely has over the last month. There is a lot of talk about serology-based testing as well. I think that's been in the press too. What a serology test looks for is antibodies. So a serology test is able to tell if someone has been exposed to any type of infection, including the novel coronavirus, COVID-19. So we're learning how to use these serology-based tests. One problem with a serology-based test is that when somebody first develops symptoms, usually there isn't detectable antibody. The body forms antibodies as it learns to fight each individual infection. So most of the time, in the first few days of illness at least, there are not detectable antibodies. Serology is often positive several days into the illness, and in general is a good marker of past infection. The trouble with serology testing for coronaviruses in general are that there are many different coronaviruses, and there are multiple circulating strains of coronaviruses that are a common cause of colds in humans. So all of this undoubtedly have been infected with at least a few strains of coronaviruses during our life. And getting a test that's good enough to pick up antibodies that are specific only for COVID-19 and not picking up some antibodies we formed against other coronaviruses is the tricky part of this. And the tests are good, but we know that there is a risk for some crossover. So interpreting these test results can be tricky, and these tests were all developed in the last 2 or 3 months that we've been trying to figure out how to test it for coronavirus. So serologic testing is evolving, and that may be a useful tool in the future to figure out who has been infected, but that's still a work in progress. There is talk as well about testing people with serology to see if they're immune to coronavirus, and we're not sure if having a positive serology means immunity. So there's a lot to learn about coronavirus 19 still, but the good initial news is that our ability to test and pick up active cases is definitely increasing, and that's going to be a very important part of the response as we ease social restrictions, is testing to find cases, contact tracing like Ellen talked about, and isolating. Those will be our main tools for controlling this disease as social restrictions ease up and we get our state up and going again. Thanks.
Thank you, Dr. Christensen. City Council President Brian von Lossberg.
Thanks. Sorry. Hello, good afternoon, and thanks for this opportunity. First and foremost, I just want to thank the entire Missoula community for its response and resolve these past several weeks. Across every facet of the community, folks have made sacrifices and stepped up to help others, to protect their families, their friends, their neighbors, as well as folks that they don't even know. It's been an act of extraordinary resolve and love, and I'm grateful for that. Everyone's grateful for that. Most importantly, those actions have made a difference, and you can see it in the data. I also want to thank the University of Montana School of Public and Community Health Sciences, Ethan and Aaron and Curtis and others, as well as the Health Department, Ellen, Cindy, Alicia, everyone for allowing me as a policymaker this window into this joint epidemiology work. I really appreciated that. We had a press conference back on Friday, March 13th, which I appreciate feels like a lifetime ago. And I mentioned that we're a community that values science among many community values that would help us get through this. This collaboration between UM and the health department and their data and modeling is yet another example of that. And these types of collaborations are helping our community look forward in a data-informed way. I think there's a tendency when we're flooded with data and numbers and statistics on a daily basis to forget about the actual people and lives behind those numbers. And I want to just mention two of those people. Jim Tomlin of Troy was the state's first death on Thursday, March 26th. Matt Newman of the Missoulian wrote a very moving account of Mr. Tomlin and his family's experience. And his son, Mr. Tomlin's son, Scott, made a point about the scores of people his father's life and death affected. Similarly, just this past Monday morning, Bill O'Connor of Livingston passed away. Among other things, he was a teacher in the community there for 30 years. And by pure coincidence, I've exchanged messages recently with a longtime Livingston resident who's been living here in Missoula for the past year. And he pointed out that Mr. O'Connor was his son's teacher for several years in grade school, very loved and known throughout the community. And these types of community connections in Montana are commonplace to us here. This happens all the time. Big state, but small in terms of being connected to folks. So despite our large size, we're all closely connected in countless ways. To turn to the theme of risk and prevention that others have hit on, I think it's important to note that we're not out of this, we're not on the other end of this by a long shot. And I just want to underscore three key messages. When we look backward, as others have said, the directives for stay at home and the social distancing measures have made an impact. There's still a risk, but we want the sacrifices that everyone's made to matter as we move forward. And then these last 2 points, as we look forward, social distancing practices will continue to be necessary. You see this in the data. Small changes in behavior can have a significant impact on how things look moving forward and the resources that we have to address things. We've had community spread here in Missoula, and we want to keep additional cases to a minimum as we open back up. So again, thanks for all you've done as a community, and thanks in advance for your continued safe, responsible behavior. Thanks.
Thank you. And lastly, Incident Commander Cindy Farr.
So as everyone has heard everyone else talk about up to this point, it is really important that we just continue to do the good job that we've been doing here in Missoula County and continue to use those social distancing measures and face coverings to try to really limit the amount of spread that we're going to see in our community. We are far from being over this outbreak. I know that I have gotten emails. I know Ellen's gotten emails. We've gotten a lot of comments on Facebook that people think that the outbreak is over and we should be able to resume life as normal. And I just want to stress to people that we are definitely not at the end of this outbreak. We are going to continue to see spread. And what we need to do is just try to keep it to a minimum so that we don't overtax our healthcare systems and so that people who do get sick are able to actually access the medical care that they need in order to get well again. So with that, thank you to everybody out there, and I will turn it over to Alicia to open it up for questions.
Okay, thank you, Cindy. We do have a few minutes for questions from the media. I know that on this platform it's a little harder to show that your hand is raised, but I will do my best to work through and allow people a chance for questions. Does someone from the press have a question for any member of our team today?
I do.
Hey, this is Megan Mannering with KPAX. Can you hear me?
We can, yes.
Perfect. Question is for Ellen or Cindy. As some of our neighboring counties begin reopening at a different pace than us, are you concerned about people leaving Missoula County and maybe, crossing over into other counties and using their services and then coming back? For example, if somebody is going to drive over to Ravalli County, get a haircut, and then come back to Missoula County, now that we've seen these concrete numbers saying the stay-at-home, order is working, is that something that you are concerned about?
I think it's definitely something that we think about because the virus, given that it has spread the globe, doesn't recognize political boundaries. However, our abilities to protect our own citizens, which statutes require us to do, both for the governor, the state health department, and then in Montana, we have a decentralized public health authority that puts the duty and the responsibility on the local health officer and the board. We have to do the best we can in our community. So your question is a good one, but I also understand that they're in a statewide order. I can't speak for the governor, but he has to consider counties that are very different from Missoula. They may not even have a hospital. They may have a very few businesses. And this whole range, some of which are frontier counties, all the way up to counties like ours, the second most populated county, the home of a healthcare hub that serves a large number of Montanans. So one of our incident objectives is to protect that healthcare hub. And that includes protecting the people that live in the community that work at the hospital. And they may have adequate protection at the hospital, but if you don't have cautious controls in their community, you then can lose some of your capacity through your healthcare workers. So it's kind of, where do you want to compare it to? You can say, well, let's compare ourselves to Idaho, because Missoula right now is a little closer to the Idaho border than it is to Billings. So those are fair questions, and we do ask and try to answer those questions to be aware. But Idaho, for example, has a stricter, more phased reopen approach for their whole state than Montana does. However, we have a decentralized public health system that, again, the statutes put those requirements on us. And while it is getting better, the data are improving. We did have 9 active cases in Missoula at the time the governor opened the shutdown. That's after a month of stay at home, which is the most rigorous thing you can do. And just this week, we are starting to be able to expand our testing. So those are the kind of indicators that I have to look at as I'm charged with under statute. And I continue to look at those. And in a week, things have improved. But with an incubation period of being 14 days, the smallest segment of time on which we could base a revision of any orders is really that 14 days.
And
Perfect.
I would just like to add one thing to Ellen's response to that is that we know that people we're not limiting people to, you can't travel outside of our county, and we recognize that people are going to be traveling outside of our county, but that is why we really do have to make sure that people are aware of all of our testing resources, because we can't shut down our county borders. And like Ellen said, this virus doesn't recognize political boundaries. And so it's just really important for people to recognize that the symptoms changed. The CDC's list of symptoms changed that can be consistent with COVID-19. And it's just really important that people stay aware of what those symptoms are so that they can get a test scheduled if they start developing those symptoms. The one thing that we can do is try to limit our exposure to other people. So, while there is not a stay-at-home directive still in place, it's still important to limit your social gatherings and continue to practice good social distancing, and just keep a close eye on your own health so that if you start developing any of those symptoms, you can get a test done and limit your interactions with other people.
I also have concerns that go in the opposite direction. Will people leave Missoula for a service and come back? Yeah, they may. Missoula is a draw. In fact, we draw a large part of our healthcare force from other counties that are less protected. rather than say, okay, they're less protected, why don't we be less protected too? I think for a large county that is the home to that healthcare facility for a large reason, it needs to be more protective. That does not mean we won't progress on reopening. We have that ability. We are watching the data. We are seeing improvement, and revisions will be made.
I have a question. Can you guys hear me? Okay.
Yes, we can.
I have a couple questions. First is for Ellen. Are you surprised other large counties didn't add limitations on the governor's order?
I think every large county has a different set of circumstances that are not, part of it is science, part of it isn't. Some people look at Gallatin and say, oh, they've been the hardest hit. Well, historically, they were the hardest hit. But at the time of the reopen, we had 9 active cases and they only had 1. So you see, there's a lot of reasons why second guessing that is really not helpful. We do communicate with each other and try to be consistent where we are able to.
Thank you. And then my next question is for the epidemiologist. I'm wondering, first of all, I've seen this graphic shared all around of comparing COVID-19 to other pandemics, and those big colorful balls, and they look really big for other pandemics, and COVID-19 is small. But would our COVID-19 ball be much bigger if it hit back in those time periods, like when the plague happened, when those pandemics happened, without our technology and resources?
I don't know who wants to take the lead on this one, but I can start out. I think it would certainly be bigger if we didn't have the ability to effectively communicate and diagnose cases like we do today. That said, the world is a lot smaller today and travel is a lot easier, so it also might spread more quickly today than it would have in the past. So that's a difficult question to answer, but I think we would certainly see many more cases if we did not do the social distancing guidelines that you've seen put into place. So I'm curious, once we have more information on the virus, if modelers will use their models to say, here's what could have happened and how much we help decrease the number of cases based on our social distancing guidelines. So I don't know if anyone has anything to add to that. But.
I don't, Ethan. That was great.
Okay, then I have one more. I'm sorry. I'm wondering also for the epidemiologist, or even with the health department, this video of those doctors from Bakersfield is making the rounds on social media, and I know there's a lot of kind of controversy about that. And they're saying the stay-at-home measures are unnecessary. Wondering if you have a response to that or a message to people who are getting on that bandwagon from those doctors.
I'll defer to Cindy and Ellen on that one.
So I just think the science supports the stay-at-home orders and social distancing and wearing face coverings. All of the science supports that, and so I don't know what science those doctors are looking at, but it's clearly not the same science we are.
Okay, thank you so much.
I have 2 questions. This is Stella with ABC Fox. Can you guys hear me?
Yes.
Okay, sounds good. I just wanted to ask, could you guys give us numbers of how many serology tests you guys have done, the antibody testing that you guys were talking about? I know you said it was difficult because there's multiple different strains of coronavirus, but I was wondering if that was a number that you could tell us.
The health department doesn't do any. I don't know if Dr. Christensen has an answer for that.
We're not using serology testing because it's really not useful for active case finding. But yet, to my knowledge, very few serology tests have been done in Missoula County. I believe there is a clinic that is doing some, but people are trying to figure out how to use serology. So that's not really a tool we're using right now. It may be in the future.
Thank you. And then my other question is, the graph shows that with the loose phased reopening, or with the phased reopening, there will be an influx of cases. Those numbers will expand over time. Do you guys plan on expanding your team for contact tracing moving forward? Or is that something you guys will figure out as the numbers increase?
Yeah, so we have a long-range plan in place for each of our different sections and each of our branches. And that long-range plan does include what we call incident management action points, where we say, okay, once we have a certain number of cases or a certain number of contacts, then we need to expand our team and hire additional nurses. So we do definitely have that in place right now. We do expect that we are going to see an influx of cases as we're reopening things, and that's pretty much what has to happen because we have a very naive population that has not been exposed to this disease, which means anyone is susceptible to it. And at this point, as Dr. Christensen has said, we don't really know if people are actually protected from reinfection with this disease. And so we do have to look at those numbers and really look at what our caseloads look like as we start to reopen things and see additional cases. And we do have plans in place for expanding our team when we need to.
Thank you.
And if I might just add one thing to that, just that the model isn't static. We're not saying there will be 20% infected in a certain period of time. We are constantly updating the model as new data come in. Thanks.
And I would just add that we don't really know what percentage of the population has been infected. And so while it is true that basically in the last week, we have experienced a very hopeful change in testing capacity. I mean, all the pieces have been in place. It's just been really hard to get the swabs, absurdly so. But we still don't have data about what the infection rate was historically because we didn't have that testing. And so that is a weakness when you're trying to make an epidemiological assessment. Going back to Erin's chart, how many have been infected, how many have recovered? We don't really know that. And if we knew that, that would change some of the data that goes into that model. So I think we've only tested about 1.4% of the entire population of the state. That does leave a hole in some of the data.
I'll jump in with one more on that note, if that's okay. I think one of the doctors said 1 in 3 tests could have been false after 4 or 5 days of symptoms. I mean, that has to add to that hole, I imagine, in a big way.
I think I'm supposed to do more than nod and say, yes, yes, it could.
Okay.
Okay, well, thank you for joining us, everyone. Something I'll say in conclusion is that we do have a page on our missoula.co/cvirus webpage where we will be posting ongoing data from our EPI team. So be looking to that for some regular updates so we can keep the public informed. And thank you very much to our team and our presenters today and to everybody who joined us. Have a wonderful rest of your Thursday.
Thank you.
Thank you.